Hello everyone, welcome back to my YouTube channel Amit Physiotherapy Classes. I hope you all are getting benefited through my lectures. So today I am going to continue with knee complex part 4 where I will be going to discuss about role of patella. How patella is going to be one of the important structure of the body in the knee joint when we are doing flexion and extension. So let us begin. As you can see on the screen, we have knee joint and we have one pulley. Here you can see this is the pulley. Pulley is defined as a grooved wheel around which the ropes are going to pass. Okay, so this is the mechanical pulley. Why this pulley I am showing you here? Because in our human body, the patella bone works as a anatomical pulley. It works as a anatomical pulley. So if you see this mechanical pulley here, on this pulley one side one rope is going and another rope is on the either side, so it makes the work very efficient with the help of the pulley. Okay, if you want to lift a very heavy load, then you can make one effort from the other side, and if pulley is there, this load will be lifted easily. So similarly, somewhat similar in body also, we have one of the patella as a anatomical pulley. So here what is going to happen, as we know, on the superior part of patella, we have a quadriceps tendon which is formed by the quadriceps muscles, and once the quadriceps tendon is going to pass through the patella, down it is termed as patellar tendon, which is inserted on the tibial tuberosity. This is known as our tibial tuberosity. So this patella in between of quadriceps tendon and in between of patellar tendon, this patella acts as a anatomical pulley, making the work efficient. So let us discuss in detail about this. So our topic is patellar influence on quadriceps muscle function. How patella is going to influence the quadriceps muscle function, means if patella is present, then how it is going to work. If it is absent, what will happen to quadriceps muscle? So these are the things what we are going to discuss here. So as we know, the function of the quadriceps muscle is strongly influenced by the patella. Even we can say the function of patella is also influenced by the quadriceps muscle. So what is going to happen here? Patella is going to lengthen the movement arm of the quadriceps. Patella is going to lengthen the movement arm of quadriceps. How? By increasing the distance of the quadriceps tendon and patellar tendon from the axis of the knee joint. This is what is going to happen. Okay, so how patella is going to influence the quadriceps muscle? Actually, the presence of patella around the knee joint is going to lengthen the movement arm of the quadriceps. How it happens? By increasing the distance of quadriceps tendon and patellar tendon from the axis of knee joint. As here you can see in the diagram, this is the knee joint. Okay, this is our femur bone, this is our down is tibia, and we have a small sesamoid bone here in the front of the femoral lower condyle, which is known as patella. This is our patella. This red line upside, it's showing the quadriceps tendon, down it is showing the patellar tendon, insertion is on the tibial tuberosity. Okay, and this is our the axis, center of the axis, knee center of rotation. Now what you can see here, what is happening, this is known as moment arm. This is known as our moment arm, means the perpendicular distance from the joint axis, from where we are getting the angle of pull, of the muscle. So what you can see here, due to the presence of patella, this is the patella, due to presence of this patella, this movement arm is increased. Okay, if what happen, if this patella is not here, the quadriceps tendon and patellar tendon, they will come to lie on the condyles of the femur, and then you can see the distance between this is reduced. That time the movement arm will be reduced. So as we discussed, patella is going to work as a anatomic pulley which deflects the action line of quadriceps femoris muscle away from the joint center. Just now we have seen, due to the presence of patella, what is happening? The patella is doing what? It is deflecting the action line of quadriceps femoris muscle away from the joint center. Now what will happen if it is deflecting it away from the joint center? Due to this, there is increase in the angle of pull and ability of the muscle to generate an extension torque. Due to this, we will be able to generate an extension torque. As you can see here in diagram, what is happening, as patella is present here, and now due to the presence of patella, what is happening, the movement arm is increased. Now due to this, you can see the pull of the quadriceps muscle, it is away from the joint axis. It is away from the joint axis. Due to this, away from the joint axis, when we are getting the angle of pull, it is making efficient knee joint to produce the knee extension when we are trying to do knee extension from flexion position due to this structures. So as what is happening here, patella was working as a anatomical pulley, due to which there is a deflection in the action of line of which muscle, quadriceps muscle, and it is away from the joint center. This is all due to presence of patella. Okay, so the angle of pull is increasing. So due to this, the ability of the quadriceps muscle is to generate an extension torque. Now this tension, the tension which is going to increase, this tension in the patellar tendon on inferior aspect of patella is less, and this tension is more where on the superior aspect of the patella. Let us see via diagram how it is going to happen. Now as we can see in this diagram, what is happening, the quadriceps tendon is inserted here. Okay, and from there it overlaps, it goes off from the, means it passes through the patella from the upper part, and lower part is known as our patellar tendon. Now what is happening, when quadriceps muscle is trying to do a contraction, the more force is generated here on the superior part. There is less force generated, tension. The more tension is generated on the superior part, there is less tension on the inferior part. This is what they are trying to say. So now it should be clear that tension in the patellar tendon on inferior aspect of patella is less, and it is where more, it is on the superior aspect of the patella, it is more, the tension in the quadriceps tendon. Now let me show you how the patella is going to deflect the action line of quadriceps muscle. Here you can see two diagrams. Upper side diagram where patella is not present, in lower diagram where patella is present. Okay, now what is happening, if you see here, this blue arrow which is representing the action line of quadriceps, and here also it is representing the action line of quadriceps. Now, and this red line is the movement arm from the center of the axis. Okay, now if you see, if patella is not present, what is happening? First thing, moment arm is small. Okay, and the action of line is not too far away from the joint axis. Now if you see here, the presence of patella, what it is doing, it is increasing the moment arm, plus it is deflecting the quadriceps action line away from the joint axis. This is how patella is very important for our knee joint. It is making the work to be more efficient. So what happens when we start doing our flexion? During our early flexion, the patella is primarily responsible for increasing the quadriceps angle of pull. Means when our knee is in full extension, from there we are just going to start the initial early flexion. That time patella is responsible for increasing the quadriceps angle of pull. But now what happens during in full flexion? Now we will see from here what happens from full flexion to full extension. This was the first point. It is stating that during early flexion, okay, during early, when we started going towards the flexion movement, the patella is the primary responsible for increasing the quadriceps angle of pull. Now in full knee flexion, as we all know, the patella is fixed firmly inside the intercondylar notch of the femur. This is what happened when our knee is in extension position, the patella lies over the femoral sulcus. Okay, it doesn't goes inside the notch. Okay, where is intercondylar notch present? It is present on the lower condyles, on the lower part of the femur, in between the medial and lateral condyle, that divides the notch. Okay, there is one more structure which is known as intercondylar tubercle, which is present on tibia, which separates the medial and lateral condyles of tibia. But here we are discussing about intercondylar notch. Okay, so during full flexion, what is happening? The patella is fixed firmly inside the notch, And during this time, what will happen, which effectively eliminates the patella as a pulley. During this time, our patella will not work as a anatomical pulley. Okay, this point you have to keep in mind. But have you ever thought, once we have said in previous slide that patella is working as an anatomical pulley, then only doing the extension movement is easier, because our quadriceps tendon and patellar tendon, they are going to glide on the patella bone. Now, but during full flexion movement, patella is inside the intercondylar notch, and that time what is happening, which is effectively eliminating the patella as a pulley. But despite this also, what will happen, still we will be able to do the knee extension. How? Let us see. Despite this, the quadriceps maintains a fairly large movement arm. Still our quadriceps is going to have a large movement arm to able to produce torque in full flexion also. Even our knee joint is in full flexion, still our quadriceps muscle will have a large movement arm to produce a torque to come from full flexion towards the extension, if still our patella is not working as a anatomical pulley. Now, how it is going to happen? This is because the rounded counter of the femoral condyle. If you remember, the condyles of the femur, the lower part, they are also in a rounded like structure. Okay, from the medial side and either from the lateral side. Now, as soon as the patella is inside in full flexion, patella is inside the intercondylar notch, but still quadriceps is going to have a greater amount of movement arm. Due to which structure? Due to the rounded counter structure present on the femoral condyles on medial and lateral side. Now, due to this rounded counter of the femoral condyle, which deflects the muscle action line, and because the axis of rotation has shifted posteriorly on the femoral condyle. So, what is going to happen? Earlier, patella bone was there, which was deflecting the action line away from the joint axis. Now, patella is inside the notch. Now, the quadriceps tendon is going to work on the femoral condyle. Due to this, what happens, and as we know, if this is the patella bone, condyles are present here. So what happens, earlier it was like this tendon here. Now the tendon came here somewhat because patella is inside the intercondylar notch. Now they are rolling on the condyles of the femur. Now what is this happening? Due to this, there is the quadriceps maintain a reasonable ability to produce torque in full knee flexion, although the patella is not contributing to its movement arm. So this is the another reason, if our patella goes inside the intercondylar notch, still from that position of full flexion, we are able to generate a torque to produce knee extension. How? Because that time the anatomical pulley is going to work, means the behavior of anatomical pulley will be done by femoral condyle, on which we will be getting the movement, and that femoral condyle is going to deflect the muscle action line. That femoral condyle is going to deflect the muscle action line. Okay, so this is how the movement takes place. Now, during knee extension, okay, so we have discussed two things. First was during early flexion. Okay, during early flexion, quadriceps, the patella was increasing the pull of the quadriceps. Okay, then in full flexion, what was happening? Patella was not working as a anatomical pulley. That time femoral condyles were working as a anatomical pulley to generate the torque. Now, when our knee joint is coming in extension movement from full flexion, what happens? Slowly the movement arm of quadriceps muscle is going to be lengthened. Okay, the movement arm is going to be lengthened. As now what will happen? The patella will start to come out from the intercondylar notch, and it will begin to travel up over the rounded femoral condyle. Okay, and about 50 degree of knee flexion, as we reach to the 50 degree. Okay, as we reach to the 50 degree, we are going towards the extension. Okay, as we reached about 50 degree, the femoral condyles have pushed the patella as far as it will go from the axis of rotation. When it was full flexion, the patella was inside the notch. As soon as extension started, patella started to leave the intercondylar notch and it came up. Around 50 degree, towards the extension movement, what happened? The patella came outside, okay, and the femoral condyle have pushed the patella outside, which is away from the axis of rotation. And about during 45 to 60 degree of knee flexion, about during 45 to 60 degree of knee flexion means when we are in between this, all still we are going towards the extension movement. When we reached 45 to 60 degree, there the peak torque will be more. The peak torque can be observed. How it is observed? Because during this range of motion, the moment arm and length tension relationship of the muscles are maximized. So this is the mid range 45 to 60 degree, where we will have a greater amount of torque to produce the extension movement. If you would have noticed, if you want to kick a football and if you keep your knee joint in full extension position, okay, and then you try to kick, the force will be not more. Even if you take your full knee in flexion and from there you are going to generate, half of the force will be wasted. But if you keep your knee somewhere around 45 to 60 degree of flexion and from there you want to kick a ball, you will get more amount of torque generated to kick the ball to bring the knee joint in extension. That is the position. Why? Because during that time the moment arm and length tension relationship of the muscles are in maximum stage. As soon as we come towards the final extension, what happens? The moment arm once again decreases, it becomes less. Okay, so this is all about how the patella moment arm is going to decrease and become more, and how it is going to help in producing the knee extension, or how the quadriceps action line is away from the joint axis in producing the extension movement. Now, as we know, the patella effect on the quadriceps moment arm is diminished in the final stage of knee extension. Okay, during 45 to 60 degree, it was on the maximum stage. Okay, but as soon as we are on the final stage of knee extension, the patella effect on quadriceps moment arm is becoming diminished. Okay, now what will happen? Near end range extension, the quadriceps is in a shortened position. As we know, quadriceps is contracting to bring the knee in extension. So this muscle is going for shortening, which reduces its ability to generate active tension. Now here in last 15 degree, last 10 to 15 degree, what is going to happen? The momentum is going to become less. It is going to be diminished. Now due to this, the quadriceps and during this stage, what is happening? The quadriceps is going for shortening. Quadriceps is going for shortening, which reduces its ability to generate active tension. So what should be happen to produce full knee extension? So the decreased ability of quadriceps to produce active force makes the relative size of momentum critical to torque production in last 15 degree of knee extension. Okay, now this will be a critical situation, because as we know, in last 15 degree momentum is going to be reduced and active contraction of quadriceps is also going to be reduced. Okay, the ability of quadriceps is going to reduce. So how it is going to work? So in this range, the quadriceps must increase the motor unit activity. Okay, the quadriceps muscles motor unit should become here active, and it has to offset the loss in active tension generating ability and decrease in momentum. So as we know, in last 15 degree, what is happening? There is less amount of there is reduction in the momentum. Okay, and there is decreased ability of quadriceps to produce active force, but we know we need full extension. Now how that extension is going to be provided? That time in that range, the quadriceps muscle must increase their motor unit activity to offset these above 2 points, that is to decrease in the momentum. They have to offset this decreased momentum, and they have to offset the loss in active tension generating ability. Now let's discuss about something about quadriceps lag, because this is the also important part of this chapter what we are discussing here. As you can see here, the patient is, or the person is in lying position. Okay, and here he is unable to produce full knee extension. You can see here still there is a loss. Okay, now how this is happening? As the name suggests, quadriceps lag, means quadriceps is unable to produce the full movement. There is something lagging behind. It is unable to reach till the terminal range. So let us discuss how it is going to happen. If there is a substantial quadriceps weakness, okay, if there is a weakness of your quadriceps muscle, or if patella has been removed, okay, maybe it got injured due to trauma and a procedure which is known as patellectomy, where the surgeon has removed the patella. Now what will happen? The quadriceps may not be able to produce adequate torque to complete the last 15 degree of non-weight bearing knee extension. As in the previous image what you have seen, the person was in lying position, so it is known as non-weight bearing. So in that position, if patella is not present or if there is a weakness of quadriceps muscle, the person will be unable to do last 15 degree of extension. So this is known as our quadriceps lag, quad lag, or extension lag. Okay. So that we have discussed about the non-weight bearing. Let us discuss something about weight bearing. Now what is going to happen in weight bearing position if the condition is still same, means patella is not present or quadriceps is weak. So as we know, in now what is going to happen during our weight bearing position, that time assume that the tibiofemoral joint is going for flexion. It is in flexion position, and the removal of patella or quadriceps weakness will have less effect on the ability of quadriceps to generate the extension torque, because the femoral condyle also serve as pulley and the total muscle tension of the quadriceps will be greater than in muscle shortened state. Now what they are trying to explain in this paragraph, which I have read from here to here, that as we came to know, if patella and quadriceps, if patella is not present or there is a quadriceps weakness, we will be unable to produce quadriceps movement, that is to generate the extension movement. But in this, when our knee joint is in flexion and in weight bearing, still we can produce the extension torque. How? Because during this time, as we know, the femoral condyle also work as a anatomical pulley, where we can where it will serve as a pulley and the movement is possible. So we can say the patient will not have a quadriceps lag in weight bearing, because that time two important more muscles are there which are going to help and assist to quadriceps muscle, that is soleus and gluteus maximus muscle will assist the quadriceps with knee extension once the foot is fixed, that is in weight bearing position. Let us see this by a diagram. As you can see in this image, what is happening, this is our gluteus maximus muscle, okay, and this is our soleus muscle. Here the tibiofemoral joint is in somewhat in flexion position. Now assume like quadriceps is weak or patella is not present. Okay, so the generating extension is not possible in weight bearing, non-weight bearing position. But in weight bearing, what will happen? Still we will be able to generate the extension. How it is going to happen? If you draw the resolution force of the gluteus maximus and if you draw the resolution force of soleus muscle, both are in posterior direction, so they will try to pull the knee in extension. And one more thing, there is one more important structure which is known as TFL, transverse fascia lata, which is also going to assist in this extension movement apart from gluteus maximus and soleus. Now one more important role of patella, the patellar role in increasing the angle of pull of quadriceps, that we have already seen how patella is going to increase the angle of pull of the quadriceps. Now here the patellar role in increasing the angle of pull of the quadriceps enhances the quadriceps torque to produce extension, but at a cost. It has to pay some cost. Okay, so what is that cost? As you can see here, two diagrams, A image and B diagram. Here the femur, here the knee is going in extension, the tibia is going in extension, this is femur. Okay, the tibia is going in extension. In B diagram, it is going in flexion, it is going towards the flexion movement. So let us discuss what is happening here. As we know, there is increased in the momentum of quadriceps due to presence of patella. So what is going to happen? There will be it is going to increase the rotatory component. the Fy component of the pull of the quadriceps on the tibia. And we know that Fy component means that rotatory component not only produces the extension torque but also creates an anterior shear of the tibia on the femur. Okay, and this anterior shear is going to be prevented by ACL ligament. ACL ligament is going to prevent the anterior tibial translation. Now this is what let us discuss with diagram. Now in this image, what I can show you here, during the extension movement, as we can see here, this is our up one is our quadriceps muscle and this is our quadriceps tendon. Okay, and down we have patellar tendon. This is our patella bone. Now the knee joint is going in extension. Now here if I draw a resolution of force for the patellar tendon, what is going to happen, where from the insertion point, there is two component, one is known as our rotatory component and one is our known as translatory component. Okay, so this is our resolution of force, that it is going from away from the joint axis and we are getting extension. Now if you see here what is happening, due to the rotatory component, it is not only producing the extension movement, it also can translate the tibia in anterior direction. It is having the capacity to move this tibia bone anterior translation. It can dislocate or it can subluxate if the pull of quadriceps is more. Okay, it can subluxate. There can be a subluxation of tibia by making this tibia to travel in anterior direction. Now there is one ligament which is known as ACL that is playing an important role here to prevent this anterior tibial translation. As we know, ACL starts from the anterior tibial spine here and it goes on the posterior side of lateral femoral condyle. Okay, posterior side of femoral condyle. So it like cross is from anterior to posterior direction. So what happens when our quadriceps tendon and patellar tendon, they are trying to pull this in anterior translation during the extension, that time there is more stress on the ACL and which is preventing the tibia by going in anterior direction. So next, strain on ACL will increase. Okay, the strain on ACL is going to increase as our knee joint is going to approach the full extension. Now if ACL is absent, what will happen? As I showed you in the image, if ACL is absent and our quadriceps contraction is near full extension, so what will happen? Due to this quadriceps contraction, when we are going to reach towards the extension movement, it has the potential to generate a large anterior tibial translation, and that is the patient complains sometimes, that the patient complains a giving way, that when we walk we feel like giving way, means that my leg will come outside, the lower part of the leg will come outside. Why? Because ACL got damaged or ACL is not present, and as we are walking we know our quadriceps has the contraction, and as the quadriceps tendon insertion and the patellar tendon insertion on the tibial tuberosity, it has the force or it has the torque, that much torque which can translate the tibia in anterior direction. And as soon as strain on the ACL is evoked by a quadriceps contraction is minimum when knee is flexed beyond 60 degree. As soon as knee starts going in the flexion movement or it is beyond 60 degree, the stress on the ACL is less. So we can say the Fy component of the quadriceps diminished from its maximum value beyond 60 degree. This is how, again I will show you via diagram. Now if you see here, the knee joint is in flexion position. It is going beyond 60 degree, knee in flexion. So if you see the rotatory component Fy, it is very less compared to rotatory component Fy when knee joint is going in extension. So that time the stress on the ACL ligament will be less, and this time the anterior tibial translation also will be less. So this is what they have tried to explain here, how the patella role is going to be means important here, but at cost. What is that cost? If ACL is not present here, maybe this quadriceps can pull the tibia anteriorly and the people will complain of giving away. Thank you so much for listening.